My main fear was recovery. Because it's the spine. So if anything goes wrong, then it's going to affect him for a lifetime. So it was a very scary thought for his dad and me.
Ever since I was a child, I always walked a little bit weird. My back was always just a little bit, my posture was a bit bad. And as I kept getting older and older, my friends one day, and we realized that there was a little bit of a curve in my back. This was 4 years ago, and I got checked for my back, and they were like, "Oh, you have lumbar spondylolisthesis in your lower back." And at first they were like, "Oh, it's only grade 1, so you don't really have to worry about it, just do physio." But then last year, I came to visit my parents again, and I was at MedPark, and I was doing another test for something. And during that, they kind of scanned my spine with an MRI machine, and they saw "Oh, you have lumbar spondylolisthesis, but it's become grade 3. After that, we really started the discussion of, oh, we might need to treat this more seriously compared to what we previously had thought. So before surgery, it was really concentrated on the lower back. When I would sit for very long periods, it would hurt. If I didn't exercise in the morning, it would hurt. But then after surgery, for the first 2 months, it was very painful in my lower back, my thighs, my leg. It was all really painful.
So Mr. Arnav come to our hospital with a problem of bilateral foot pain. Okay, he has severe pain in both of his feet. The pain is like a burning sensation and electrical shock okay, so he cannot put his foot on the floor, he cannot wear socks, he cannot wear sneakers, he has to wear just sandals that doesn't compress his foot too much. In his case, it's what we call in medical term as neuropathic pains. It's when the nerve is injuries or have some inflammation or have some damage to the nerve. Instead of sending normal sensation signal, it sends pain signal down to that area. That's why he calls severe pain. If left untreated, the pain will become more and more severe. The pain will be constant all the days. Some patients might suffer from depression after they affected the pain for a long time.
Last year, when Arnav had a dengue fever when he was visiting, that's when the doctor told us that something really needs to be done. And then we decided to go ahead with the surgery. So we came back here because he had severe pain in his foot, unbearable pain over here in the nerves. The pain was so intense for so many days that he would be screaming the whole night, even if we gave him the strongest of painkillers. We came back here, and that's when we realized that there's such a big physiotherapy center here.
So in this case, the patient, the most concerning problem for the patient and his mother is the pain. Okay, so our primary goal is to decrease the pain first. Okay, so we start with occupational therapy or OT to do the sensory stimulation to decrease the pain. So normally we use normal objects in the household objects. So in this case, it's a sponge. In patient with severe neuropathic pain, just touching is very severe for them. So when the pain is less, we slowly change the object to maybe a little bit harder, from a sponge maybe to a brush. This one is a little bit harder. So at first the patient might feel too much painful, but after continuing with the sensitization, the pain will be less and less. The nerve and the brain will learn that this is a normal sensation. Okay, so the pain will be less and less. And for the physical therapy, to do PMS or peripheral magnetic stimulation to decrease the neuropathic pain and the inflammation of the nerve.
So in MedPark, it's been very comprehensive. There's been a lot of different treatments that we've done. There's been physical therapy where they had machines, the magnet and the ultrasound, where they would go over my thighs and calf and my lower back in order to relieve the pain. There's also been the physical activity part of it, where I would do walking and standing up exercises and moving around. And then there was also the hydro, and that was probably the part I liked the most, where I'd go into the pool and do exercises, as well as occupational therapy. That was what would be completed after, and I feel that really, really helped, especially during the nerve pain portion.
Arnav's walk was always different. Ever since his birth, we called it Arnav's walk because it's very different. It was like this, and now for the first time I'm seeing him walking balanced, walking with the feet firmly. So it makes me feel really good because walking is the most important thing for Arnav. He loves to walk, and exercise and be fit. So this is really good.
Everybody was really very, very good. The doctors were incredibly helpful at like explaining what was going on. The physical therapy team was really great at showing exercises and like taking care to accommodate if I was in pain. If I do an exercise, the first thing they'd ask me is like, are you in pain? Are you tired? And I really appreciated that because like I feel like that is so important when you're like, I guess, rehabilitating. And even like the occupational therapy team was so nice and helpful and like really like tried to like, check if everything was going well. And it all like altogether, it really did help me make the progress that I did.
And I'm so happy to see today he's walking so well, he's strong, he's independent. So I really have to say a big thank you to MedPark team.
Chill out, man. Yeah. Okay. Good.
MedPark Hospital, redefining healthcare.